Hi there, this is Dr. Swenson with Calvary Health, and today we're going to chat about peptides. We're going to review both the general categories of the different types of peptides that are available, what peptides are, and then get a little more detail into specific ones and how they work. So briefly, what exactly are peptides? Firstly, it's nothing more than effectively a scientific name for a short version of proteins. I say proteins like the ones that your body uses to communicate, not proteins like you would eat sitting down to a meal. Peptides are nothing more than a term for a shorter version of those proteins, 50 or less in terms of length versus 100 or more. Your body actually produces hundreds, if not thousands, of peptides naturally. And what exactly are they then, and what are they being used for? So, a little bit like hormones, and though I want to call this out, they are not hormones, but a little bit like hormones, peptides are used for cell to cell communication and have very broad reaching effects. So it's not like taking a particular drug or medication has a single effect. Like a hormone, peptides have multiple downstream effects. They might help with neuroplasticity, but also help with cognitive function. They might help with gaining muscle mass, but also increase metabolism. They might help with injury recovery, but also drive new blood vessel growth. So, and that's to say just the ones that we know how they work and most of it, the ones that we understand how they work. There are hundreds of others that we don't have a full picture of in terms of what they do. So zooming out for a second, with respect to peptides, there are more or less 5 categories that matter to most people who are exploring peptides. As a quick aside, and a very relevant aside, peptides are not FDA approved by and large. There are a few exceptions that we'll get into at some point, but they are not even FDA clear. That is to say, they are research grade only, so not approved for human use at all, even though many people are using them. The reasons behind that are several-fold, but 2 most common sources cited for the lack of approval is 1, insufficient human data to know long-term effects in terms of what they can do. And the second is that they're very hard to study and patent because they're easily manufactured. So for that reason, realize that you're really kind of outside the scope of regulated products here, and we don't know everything they're going to do long term. All right, so with that part out of the way, the categories of peptides that matter to most people. First and foremost, the most common one that I hear about and hear asked about is those for injury recovery, specifically BPC, body protection compound 157, which is sometimes paired with something called TB500. BPC 157 was discovered in the gut originally, and there's a whole story behind that we can get into some other time. But more relevantly, was identified for actually preserving amputated tissue parts during prior wars. They discovered that the gastric juices could actually preserve amputated tissue and be reattached later. That led to the discovery of BPC 157. We can now replicate BPC 157 synthetically in a lab. What does it do for you? Well, from our current understanding of the mechanism, it drives decreases in inflammation and something called angiogenesis, or new blood vessel growth. In combination, theoretically, combining those 2 effects accelerates injury recovery and wound healing for both acute and potentially chronic injuries. Theoretically, it's better off for acute injuries than chronic, but people do use BPC 157 in chronic injury cases as well. Though it can be stacked with a number of other peptides, one of the most common ones that you see it used with is TB500. TB500 goes by several other names, but in short, it's in reference to the thymus gland. Thymus gland is a gland you lose as an adult that in children we believe accelerates their wound healing, explains why they don't scar as much and why they bounce back faster. We don't entirely know why, as an adult, we no longer have a thymus gland, but we have replicated the thymus gland peptide, the TB500, which again, stacked with the BPC, can lead to further accelerations in wound healing. So that's the wound healing peptide. The next categories that we're also going to cover that are relevant to people are for cognitive health, sexual health, weight loss, which everybody's heard about at this point, of course, and skin health. So first up on the list here, cognitive health. There are several neurocognitive peptides. The most common ones we refer to are Semax, S-E-M-A-X, C-Link, Dihexa, and BDNF. BDNF is brain-derived neurotropic factor, and in fact is not commonly used because it has too short of a half-life. The other peptides are typically taken as either nasal sprays or pill formats. And broadly speaking, they improve neuroplasticity. Neuroplasticity, in simplest terms, is the ability of your nerves to make connections with each other, particularly in the brain. So as you age, you start off as a kid with many, many nerve connections that are very inefficient. Think of it like a highway, but with too many exit ramps. As you develop and grow, you cut off certain exit ramps that you're not using, and you widen the highways that are used most often. So you improve executive function, et cetera, faster communication time into the pathways you use most frequently. As you age further, your exit ramps, some of these connections, some of these highways begin to break down. These neurotropic peptides can, in theory, drive new neuroplasticity nerve connections. Do they also drive new nerve growth? We're not really sure. Mechanistically, they might. They are being studied in TBI patients, that is traumatic brain injury patients, and Alzheimer's disease patients as well. People are exploring recreationally, so to speak, in terms of preemptive utilization, brain fog, cognitive decline that they're experiencing on a regular basis, well before they hit dementia, Alzheimer's, or even severe decline. Next category, skin health, more or less pertains to one particular peptide known as GHK Copper. It can be done topically or as a subcutaneous shot, and mechanistically should drive the growth of elastin and collagen. These things help, in theory, with bolstering skin health, and may even have effects with respect to improving hair health, as well as, because of the collagen aspect, joint health. But again, minimal human data, no promises type thing. This is really in a research stage. Next up, we'll touch on PT141. PT141 is interesting because it is, in fact, a FDA-approved medication, at least it was, and to my knowledge, didn't sell well enough to actually continue. It was initially approved for women to help with libido, and it's been found to be just as effective in men. Sometimes combined with oxytocin, it doesn't help with mechanical issues, so to speak, but does help, at least in theory, with promoting drive, attraction, and interest in sexual health and in sex in general. Next up, that is very common, especially amongst let's call it the younger group, 30 to 50 years old, but we see it now increasing interest in the older population of 50 plus, is the hormones that promote the release of growth hormone. There is a class of peptides known as growth hormone releasing hormone peptides, or GHRH. And there's some nuance here in terms of analogs and whatnot that we're not going to deal with for this moment. GHRH peptides, or growth hormone peptides, to be short about it, there are several kinds. Some, in fact, are FDA approved. One was approved for the treatment of dwarfism, another for preserving muscle mass in HIV patients, and they are being used off-label for gaining muscle mass. What do? Well, they drive your body's natural release of growth hormone, which, unsurprisingly, does just what it sounds like. You can think of it a little bit like whey protein. That is to say, if you take some of these peptides, the growth hormone peptides, and don't hit the gym, you're not likely to see many results. Theoretically, however, if you hit the gym, exercise, resistance training in the setting of these, you will accelerate muscle gain. These are sometimes also being utilized in conjunction with the weight loss peptides, the semaglutides, et cetera, of the world, to prevent some of the muscle loss we see in that patient population. The other interesting part about the growth hormone peptides is that by prompting release of your natural growth hormone, they can, in some people, promote further deep sleep cycles and increase sleep quality. And the last category of peptides is the weight loss peptides. So not everybody realizes this, but the Wegovy, Ozempic, essentially the semaglutides are, in point of fact, a peptide. And as people know, they've now been patented, there's brand names around them, et cetera. As it relates to my earlier comment that most peptides are not patented, well, these weren't quite patented either. The FDA approved the combination of the peptide with the auto-injector pen, which is what actually Eli Lilly, et cetera, are selling, so to speak, under the brand name. So in short, those are the peptides we talked the most about. Certainly the most common ones that people seem to be talking about in the clinic are BPC-157 and TB-500 for injury recovery, and the growth hormone-releasing hormone peptides. That said, there are literally hundreds, if not thousands, of other peptides that are being manufactured right now. Some of them have their own particular use cases. Some boost immune system health, others may boost sleep health, etc. But all of them, with a few exceptions, again, are considered research grade, and we don't know the full repercussions of what 5, 10, or 20 years of human use of these peptides will actually do. As an example, just for a reference check, semaglutide, we're now saying, well, it's great for endometriosis, but it's also causing some spontaneous blindness. So we don't really know why all these things are happening, because a little bit like hormones, they have a plethora of downhill effects. So what do you do about that if you're exploring the peptide space? Well, firstly, obviously, make sure you're talking to a clinician who can at least inform you on what the risks and benefit are, how they might pertain to you specifically, what kind of lab testing or other imaging studies, et cetera, may be relevant to you in terms of monitoring your progress, where you're trying to get, as an example, DEXA scans for muscle gain and loss of visceral fat, or GRAIL diagnostic blood-based cancer screenings on a regular basis. There's a number of ways to go about it. Again, very much so individualized based on what you're trying to accomplish. And that about summarizes, again, kind of the state of where peptides are right now.